Hello, everyone. Welcome to today's event organized by the APAC Liver Disease Alliance entitled All the Line, Hepatitis and Liver Cancer Elimination in Challenging Times. This is the APAC Liver Disease Alliance contribution to World Hepatitis Day. And my name is Roberta Sarno. I will be your host. Let's start with some facts, and these infographics are shared by the World Hepatitis Alliance for the World Hepatitis Day every year. So hepatitis is the leading cause of liver cancer. There are more than 2 million new cases of hepatitis every year, and every year more than 1.3 million lives are lost to hepatitis B and C, which means that every 30 seconds, someone loses their life because of hepatitis. Despite these facts, still too many people find it difficult to tell others that they are living with hepatitis, highlighting a big issue with stigma and fear of discrimination. More than 300 million people live with hepatitis currently. Most of them don't know it yet. And despite this, that hepatitis is one of the deadliest viruses. Actually, it's the second deadliest virus in the world after COVID-19. More than half of liver cancer cases could be prevented through testing, treatment, and vaccination for hepatitis. So it's really urgent that we step together as a community in order to eliminate hepatitis and then prevent people from dying for diseases associated with hepatitis. Before we start, and I'll dive into the agenda for today's session, let me share a few facts about the APAC Liver Disease Alliance, which is hosting today's event. This is a neutral, multilateral, and multi-stakeholder platform that has been introduced in 2023. We have the honor of gathering many key liver health organizations as part of our membership: the Coalition for Global Hepatitis Elimination, the Global Liver Institute, the International Liver Cancer Movement, the Hepatitis Fund, the Yellow Warriors Society Philippines, and the Harvard Medical School with their project in the Asia Pacific called STITCH. We also have healthcare companies as part of our membership, including Abbott, AstraZeneca, and Roche. And we collaborate very closely with key opinion leaders and decision makers from across the region. Our knowledge partner is Vista Health, who helps us on getting content done on many different topics related to liver health. We came together a bit more than 2 years ago with a mission in mind to reduce the growing burden of liver disease and its social and economic impact on the Asia Pacific region's 4 billion inhabitants. So our focus is on the Asia Pacific, and our work encompasses publication and reports, knowledge sharing, and facilitating collaboration, driving strategic partnerships with many different stakeholders from across the region, including policymakers, clinicians, patient advocacy groups, key opinion leaders, liver health organizations, academia, and of course, healthcare companies as well. We are very active in patient advocacy, stakeholder engagement. We also have a mission to build consensus so the region can speak with one voice. We build capacity. We are involved in thought leaderships, and our final mission is to impact the policy so that patients across the Asia Pacific region can get the care they deserve when it comes to liver health issues, including hepatitis, hepatocellular carcinoma, and more. You can visit our website. We're providing here a QR code and that you can scan and visit our website to know more about the Alliance, what we work on, our publications, our event, and our policy work. You can also follow us on LinkedIn. We are very active there. We post weekly, and we share all the work we do and the collaborations and initiatives we drive. Let's go back to the agenda for today. I will very shortly give the floor to my colleague, Will Brown from Vista Health. Will share with us a new infographic. We've been working together in the past few months in collaboration with ministries of health, clinicians, professors, key opinion leaders, and patient advocacy groups. This infographic is a refresh of what we have published 2 years ago. And the idea was to capture the progress made by the region when it comes to hepatitis elimination and hepatocellular carcinoma surveillance and management. After that, I will come back and I will share with you a very recent publication we've released just a few weeks ago. It's a policy paper titled Roadmap for Hepatocellular Carcinoma Surveillance and Management in the Asia Pacific. And after these two publication announcements, the infographic and the paper, we will gather with experts from across the globe for a panel discussion on what's next for hepatitis and HCC elimination in challenging times. And we will then close with some final reflections and a call to action. With that, I would like to now introduce our first speaker, Will Brown from Vista Health. Will, over to you.
Hi, everyone. My name is Will Brown, and I'm here to talk you through the APAC Liver Disease Alliance infographic, now in its second edition, highlighting the progress that's been made since its first launch in 2023. The APAC Liver Disease Alliance is a multilateral platform that brings together diverse stakeholders across Asia Pacific. Its mission is to reduce the growing burden of liver disease and its social and economic impact in APAC. Vista Health is proud to be the knowledge partner of the APAC Liver Disease Alliance. Together, we've worked to raise awareness, strengthen political will, and support national efforts to eliminate hepatitis and reduce the burden of liver cancer across the region. Viral hepatitis is often called Asia's silent emergency for good reason. Hepatitis-related illnesses are killing over 800,000 people in APAC every year, counting for more than 60% of the global hepatitis death toll. To put it further into perspective, in our region, the death rate from hepatitis is roughly 3 times higher than that of HIV/AIDS. Now, turning to liver cancer, HCC, which is primarily caused by chronic hepatitis, it's the 5th most common cancer in APAC, but the 2nd most deadly cancer here. These statistics underscore the urgent need to address hepatitis and liver cancer and address them together. If we don't act now, the health and economic toll will continue to rise. Now, to develop this updated infographic, our team started by conducting a targeted literature review covering the latest available data and policy. Leading hepatitis and HCC experts from across the region were also closely involved in shaping the infographic. We've engaged clinicians, researchers, and policymakers to review and validate findings, ensuring that it's clinically and policy relevant. Over the past couple of years, there have been notable developments in policy, programs, and outcomes across different health systems. We highlight those changes, improvements in national plans, new funding commitments, pilot programs scaling up, and other health system advancements that have occurred since that first edition. So let's take a look. Since the 2023 edition, several health systems have made encouraging progress in their hepatitis elimination efforts. These developments from 2022 to 2025 are captured in the infographic, indicated by the upward pointing triangles in the table. First, Thailand. Thailand has shown significant improvements across multiple pillars. They've strengthened their national action plan, increased funding allocations, and they've demonstrated stronger political commitment to hepatitis elimination. Similarly, we've seen some other health systems take steps forwards. Some have launched new screening campaigns, and others have improved access to hepatitis treatment. That being said, most APAC health systems are still not on track to meet the WHO's 2030 elimination targets for hepatitis B and C. This is a reminder that a concerted push and greater urgency are still required to truly eliminate hepatitis as a public health threat in our region. For HCC, in 2025, Japan remains as the gold standard for HCC surveillance and management in the region. Elsewhere in APAC, we are seeing improvements in HCC control efforts, particularly in terms of political commitment and awareness. Several governments and health systems have started to prioritize HCC as a specific public health challenge linked to hepatitis. And more health systems now have HCC mentioned in their national cancer control plans or hepatitis strategies. And some have begun pilot programs for screening or are improving clinical guidelines. Taiwan is one health system that's made notable strides. Today, Taiwan is also enhancing its HCC surveillance and management. They've integrated HCC surveillance into their healthcare system and improved funding for liver cancer programs. And they're also leveraging their strong hepatitis elimination progress to reduce HCC incidence in the first place. It's a really encouraging model of integrated care that other health systems can learn from. While awareness and commitment are improving across the region, not all health systems are providing sufficient infrastructure, funding, and access to tackle the problem. Progress is being made, and we celebrate those gains, but there's a clear need for continued efforts. Now, based on these latest insights, we continue to advocate for 5 key recommendations to guide action across the region. First, strengthen national action plans with clear goals, budgets, and governance structures. Second, to expand screening and treatment, integrating that into existing health systems. Third, secure greater funding through universal health coverage and catalytic funding models. 4, implement strong HCC surveillance and treatment pathways, drawing from best practices like Japan. And last but not least, raise public awareness and secure political champions to drive momentum to tackle stigma. These steps are vital to creating an integrated, sustainable response to hepatitis and HCC. The new 2025 APAC Hepatitis and HCC infographic is now live and available on the Alliance's website. This is the culmination of the data gathering and the expert work we described, and it's a comprehensive visual tool. Please download, share, and advocate. Whether you're a clinician, public health official, a patient advocate, or a policymaker, this tool is designed to support your work. Share it with colleagues and decision makers, post it on social media or your organization's website, and use it in presentations or community forums to spark conversations and advocate for change. Finally, we'd just like to thank all of the contributors and the partners who made this second edition of the infographic possible. Thank you all, and thank you all for listening today.
Thank you very much, Will, for sharing with us the results and the highlights from the infographic that we are releasing today as part of our work for eliminating hepatitis and reducing the burden of HCC. I'd like to continue with announcement and share with all of you about our recent HCC policy paper. In June 2025, we have been releasing this paper titled "Roadmap for HCC Surveillance and Management in the Asia Pacific," which is published in Cancers, and it's a great achievement from the entire community. This is not the result of only one organization's efforts, but it's the result of a collective work that came from clinicians, from academics, key opinion leaders, patient advocates, ministries of health, who gathered last year in an event organized by the APAC Liver Disease Alliance in October in Bangkok. We gathered and we discussed some of the pain points related to HCC surveillance and management in different health systems. And as a result of this discussion and workshop, we published a roadmap for improving HCC surveillance and management. So I'm really glad to present the results today. So first of all, how you can access the publication. You can access the publication on the APAC Liver Disease Alliance website. If you type under resources, you will find it. You will find it in 2 formats. I'm also sharing a QR code here that you can scan. You will find it in 2 formats. One is the peer-reviewed version and one is the designed version. The content doesn't change. It's only a matter of design. I hope you will take time to review the paper and, of course, get back to us if you have any questions or comment. Let me share a bit more about how this publication was built and why. So why a roadmap? We came together with this publication to answer the need for a regionally tailored, evidence-informed framework that could support national decision-making in a way that was harmonized, promoting consistent approaches across the region without losing the specificities of every health system. So this paper has been developed through partnership between ministries of health, experts, clinicians, and the civil society. And the methodology is based on a combination of literature search and expert insights. The paper presents actionable recommendations for improving HCC surveillance and management across 7 APAC health systems: Australia, India, Malaysia, South Korea, Taiwan, Thailand, and Vietnam. These recommendations are based on local expert insights and are also supplemented with learnings from Japan's success in managing HCC, and also including a targeted literature search. Why Japan, and why we took Japan as a model? So Japan has been recently very successful in managing hepatocellular carcinoma. By looking at their approach, we could identify 4 key strategies that have been critical to Japan's success. Number 1, they focused on raising awareness. So there is a very good investment in knowledge about HCC, what to do about preventing, detecting, and also managing the disease. And number 2, Japan has a very robust surveillance program, which has also enabled early detection. And we know that when HCC is detected early, patient outcomes improved substantially. And number 4, Japan has also invested massively in healthcare access, promoting really coverage for diagnostics and therapies. So thanks to these 4 key strategies, Japan is now able to detect 68% of HCC cases early, enabling patients under regular surveillance to live close to 4 times longer than the regional average. This is not only a clinical benefit, it's also an economic benefit. Because of its national surveillance program, Japan has been able to drive a 33% reduction in the overall cost of illness associated with HCC. For the development of the paper, we took a patient journey approach. So we looked at 5 key steps in the liver cancer patient journey, including awareness, prevention, early detection, diagnosis, and access to treatment. We started by analyzing the situation. We then identified challenges and then generated ideas for potential solutions in order to address all of the challenges identified for each of the 5 steps. And this is how the roadmaps look like. This is just an example from Australia, and you will find a similar table for the other 6 health systems included in the paper. But I hope you can get a sense of how specific and actionable these solutions are. For example, let's take awareness. So regarding awareness, our experts, and this has been also confirmed by the literature analysis, identified a gap regarding the needs of the indigenous and culturally and linguistically diverse groups in Australia, because these groups' needs are not addressed adequately. For example, in order to respond to this gap, to this need, the proposed solution could include involving the target groups in the community-led initiative. So this is a very actionable solution that answers very specifically to the need that is raised, and is very specific to the health system in particular as well. So there are some challenges identified for each of the steps of the patient journey. There are challenges, there are proposed solutions, and there is also an highlight on who the responsible agency or department should be to undertake these solutions. So now, how can we use this roadmap, and how you can also contribute to this work? So we really hope that you could use this roadmap to inform the policy, inform program design, mobilize funding and partnership, and also track and evaluate progress. You can simply access the paper and then go directly to the health system of your interest, and then you will find all the proposed solutions and also the rationale behind those solutions. We hope that this publication will be used by the different decision makers, and we will also use it to engage with policymakers, clinicians, program designers, NGOs in the months to come, because we will be involved in a series of closed-door roundtables to discuss some of the implementation steps that will follow the publication. Thank you very much for your attention, and I would like now to transition to our next segment, and where I will have the opportunity to discuss what's next in hepatitis and liver cancer elimination with some of the most insightful global experts in the field. So see you in a moment on the panel. Welcome back for this last segment of today's event. We're going to discuss now what's next for hepatitis and hepatocellular carcinoma elimination in these challenging times. And for this discussion, I have the honor of having with me three international experts on the field. Jessica Hicks from the World Hepatitis Alliance, Dr. Nida Ali from the Coalition for Global Hepatitis Elimination, and Dr. Janus Ong from the University of Philippines, Manila. So first of all, thank you very much for being with us, for accepting our invitation, and for being willing to share your expertise, insights, and also some suggestions for the future. Thank you. As we saw earlier today during this program, currently more than 1.3 million people die every year because of hepatitis-related illness, and close to 63% of those deaths occur in the Asia-Pacific region. Hepatitis is also the leading cause of liver cancer, particularly hepatocellular carcinoma. What we've also seen today is that we have the tools, we have the vaccines, we have effective treatments, we have programs for hepatitis elimination. Now what we need is political will, we need investment, and we need to implement the very good programs that have been designed so far in many territories. So the situation since the beginning of the year has been quite challenging, with a lot of budget cuts, funding deprioritization, and also political shifts. So I would like to explore more with the three of you, how can we still push for hepatitis elimination, for better liver cancer management and control, despite these challenging times, right? If I think of this year's campaign for World Hepatitis Day, it's about breaking it down, right? So breaking down stigma, breaking down misinformation, and also breaking down political inertia. So I'd like to now focus on how we can, as a community, break down those barriers and really ensure that the objective of eliminating hepatitis by 2030 is achieved in our region and globally. Maybe Jessica, let's start with you. And again, back to the campaign. The campaign is reminding us that every 30 seconds, a person dies because of hepatitis-related diseases. Still, many people don't know they're infected. So could you share with us more about the work of the World Hepatitis Alliance, in particular when it comes to helping communities to break down stigma and misinformation, and really help them to be better informed and then be aware of the disease, which is really the very first step. So if you could share more about that with us, and also keeping in mind maybe some recent examples since the beginning of the year, many things changed in our space. Thank you.
Great. Thank you so much, Roberta. I'm really delighted to be here today on behalf of the World Hepatitis Alliance. So the Alliance is we are a network of over 400 member organizations in over 100 countries. All of our members are civil society organizations, and together with them, we work tirelessly to raise awareness, influence policy, and drive action to improve the lives of the more than 300 million people globally that are living with viral hepatitis. And as you said, we know that low awareness, misinformation, myths, and stigma are stopping people accessing hepatitis services, and so helping to drive the increase in liver cancer cases that we're seeing globally. And that this low awareness and misinformation and stigma leads to a lack of action by decision makers. And with the recent funding cuts, this is only getting harder. And so the Alliance is helping to break down stigma by shining a light on the scale of the problem, and also giving people the tools to take action. The Alliance launched a stigma survey last year, and we piloted it with the European Centre for Disease Control in 9 European countries, measuring indicators relating to stigma, discrimination, and quality of life. And we felt that this was really important because up until now, we know that stigma is a problem, but we don't have the data to really help inform that advocacy. And some of the data we got, and this was a small pilot, which we are really hoping to expand, but even with this small sample size, the data was quite shocking. 57% of those affected by hepatitis C and 46% of those living with hepatitis B found it difficult to tell people that they were living with hepatitis. And 1 in 6 of those living with hepatitis C had said that family members had made discriminatory remarks about them. And 1 in 10 of those living with hepatitis B and C have been threatened, verbally abused, or physically harmed by a sexual partner. This is really quite shocking. And then if you look at how stigma and discrimination feed into the healthcare settings and people's health-seeking behavior, which is particularly relevant when we're discussing the links between hepatitis and liver cancer. 34% of those living with hepatitis C and 25% of those living with hepatitis B have been worried that they'd be treated differently from other patients by healthcare staff. And 24% of those living with hepatitis C and 15% of those living with hepatitis B reported avoiding going to healthcare services when they needed to because they expected to be treated differently. And I think, we're continuing to monitor the situation following the funding cuts earlier this year and the political challenges that have arisen. And I think the political landscape has certainly continued to make it difficult for underserved communities to access healthcare and, have possibly contributed to rising stigma. So this is an area that we're really focused on, especially this year for World Hepatitis Day. And so this year for World Hepatitis Day, we're really breaking down stigma through using user-generated video content to help people get the facts, protect their health, and take action. And so we've created a range of short films featuring people asking common questions about hepatitis and have enlisted a range of experts from around the world to provide clear answers and guidance. And these are going to be used across our communication channels as part of the campaign and are available for people to download and use at worldhepatitisday.org. So I really do encourage everyone to take a look at these videos and share them widely, because we really hope that they will help to dispel the myths and stigma around hepatitis and increase awareness amongst the general public. And, this increased awareness and education will be essential to breaking down the misinformation that drives stigma. So I'll hand it back to you, Roberta.
Thanks, Jessica. And I think, data-informed campaigns are always very powerful. And thanks a lot for sharing these. And we will also share the website in our LinkedIn page and via email with our community. So thank you for that. And the work you are driving on a global space is really amazing. And I'd like to transition now and maybe to a more localized point of view when it comes to the Asia-Pacific region. And Nida, I know the Coalition for Global Hepatitis Elimination is working globally and in particular in the APAC region as well. And I know you have been leading a project in Pakistan. So I'm curious to know what efforts you have been driving so far, and also how are you facing basically all the barriers related to investment, financial burden, and also systemic barriers, especially in the past few months. If you could share more about your work and also some of the challenges you are encountering and some of the solutions you are proposing. Thank you, Nida.
Sure, thank you. This is a very important question. So at the Coalition, our work in the APAC region, I'll first focus on Pakistan. So we strive to support a strengthening of political commitment and helping governments do more with fewer resources. So the Prime Minister's program on hepatitis C elimination and the domestic substantial amount of funding allocation, it represents commitment at the highest political level. But for a country like Pakistan with 250 million population and highest prevalence of HCV in the world, some international support is mandatory. So we have worked towards bringing the non-traditional donors on board, where we reached out to large national and international organizations, philanthropic donors, development banks, and also the high net worth individuals to bring their attention to this opportunity in Pakistan for funding, specifically in the context of rapidly changing funding landscape in global health and the shifting priorities towards defense. Prior to that, the coalition conducted HEAT, Hepatitis Evaluation to Amplify Testing project in Pakistan at the community level, which was an example of the partnership of resources where domestic commodities were efficiently utilized without wastage, particularly picking up on the resources that were scaled up during the pandemic and filling the remaining gap with properly rationalized external funding. This is just a demonstration of what is possible to actually hold the line and maybe even make progress without major international funding. Also, we support diplomatic engagement through the UN Group of Friends to eliminate hepatitis. This includes advocating for domestic investment and encouraging countries to use their Sustainable Development Goals, voluntary national reviews, and other platforms like NCDs and UHC to raise the profile of hepatitis and liver cancer elimination, particularly in diplomatic agendas. Yeah, thank you.
Thank you, Nida. And I want to deep dive a bit more on some of the topics you mentioned, but we can do that later on. I have a question for Janus, and I will ask you, Janus, to wear your hat as a STITCH project leader. And maybe you can also share with our audience a little bit more about this project that you are leading in the Philippines. And I know it covers also other countries, but particularly I would like to ask you some of the most recent and also most pressing challenges that we have faced while managing this project, especially since the beginning of the year, and in particularly focusing on how to continue enabling testing and treatment in underserved areas and high burden areas. And Jessica mentioned that as well earlier. So it's important that then the tools and technologies really reach the people. So how can we ensure that, and what you have experienced so far by leading this project?
Yes, hi. Sorry. Thank you, Roberta, and thank you to the APAC Liver Disease Alliance for the invitation for tonight. Well, in the more than 1 year that we've been implementing our model of care here in the province of Tarlac, we've certainly seen quite a bit of challenges. I mean, we haven't seen the challenges with regards to funding because we don't really have much in terms of external funding for hepatitis in the country. But what I think we've really seen is that because of our health system is devolved, local government commitment is very important. And sustaining that commitment is very important, and it can be very variable in the country. So if you've started the program, if the local commitment is not sustained, then the program can suffer while it's being implemented. Because without the local government commitment, sustaining hepatitis care really cannot be ensured. Now, more on a national level, I think the lack of a national action plan that is funded is also a challenge, because this national action plan really sets the strategic direction for all of our efforts, for hepatitis elimination. Although I must say that recent developments, the other thing is that we have very frequent changes in the leadership of our hepatitis program, notwithstanding the elections, and every change in leadership can be very challenging, that change. However, I think recent developments are quite encouraging because we've appointed a dedicated point person for the hepatitis program recently, and there are firmed up plans for a workshop on the National Action Plan this July. So at least there's a glimmer of hope in the short to medium term. Thank you.
Yeah, thanks a lot. And I think these are all very relevant points. And I would like to come back to some of the things you mentioned a little later on when we discuss about the future and what to do. And to start basically from a community awareness and advocacy perspective. Jessica, back to you. I have a question on, how can you and the World Hepatitis Alliance moving forward, ensure the communities are still, sharing their voice and advocating for increased access, right? Especially now that there are many budgets compromised. So how can we, as the industry and the organizations, help the communities, and what the communities can do in order to keep pushing and share the needs with the politicians, the governments, and the decision makers?
Great, thank you. So yeah, I think, it has never been more important to advocate for access to comprehensive and affordable hepatitis care. We know, unfortunately, that hepatitis has been underfunded for a very long time. And so what we at the Alliance have been doing is really trying to understand sort of what the immediate impact of some of the funding cuts have been on the ground for hepatitis services. And we're still in the process of gathering this data, and we hope to be able to share it more widely later this year. But what we're seeing is that really where services are being cut is where they've been integrated with the HIV infrastructure in countries. And, I think that is a reflection of the fact that hepatitis hasn't ever had a lot of siloed vertical funding. And so we've always been very creative around how we can integrate with other health areas. And so unfortunately, with the cuts to HIV programs and global health more broadly, it is becoming more challenging. And we are expecting to continue to see the impact on hepatitis services continue to grow as we sort of get further into the year and into next year. And so we're really looking at how we can support members through this, because we know that many countries are having to make difficult decisions around their priority health areas. And it's really imperative that as a community, we come together to ensure that hepatitis is prioritized and integrated into health systems. And so one way that we're doing that is through working with our members and other partners, including NIDA and the CGHE team, to ensure that hepatitis testing, treatment, and care is integrated into comprehensive cancer programs. And with the UN high-level meeting on non-communicable diseases and mental health in September, this is a really important opportunity to center hepatitis and liver cancer on the global health agenda. And we're really working to see this adopted into the political declaration, and then working with partners across the hepatitis and cancer spaces to look at what implementing this looks like and how we can better partner, and then giving our members the tools to do the same nationally, so that we are, delivering our global advocacy and then empowering members to be able to implement the impact of that nationally. And, our members and civil society, community groups, people with lived experience have such an important role to play in raising their voices and sharing their stories. We know that political will requires the data, but it also requires empathy, and it requires the head. So it's the head and the heart, and people living with viral hepatitis and the community groups that support them are incredibly uniquely placed to really deliver against both and help to drive that political will. But I do want to say it is not just a role of community groups to advocate, especially right now. We really need to come together as a broader hepatitis community and really partner across the different sectors, with healthcare, research, community, come together with one voice and really demand action and demand access to life-saving treatments, because no one should be dying from liver cancer. It's completely unacceptable. And we are in a position to prevent that by testing and treating hepatitis. And we all need to share that message as loud as we can.
Yeah, and it's important, Jessica, thank you for highlighting that. I think we all have a role, and everyone in this ecosystem has a role, as something to gain and something also to share and to give, right? So we really need to come together, and even, more now with this current geopolitical and funding situation, I think we need to step up and share what the priorities are. I know, Nida, you mentioned that earlier when you were discussing briefly about the work of the coalition, in particular in Pakistan. You mentioned the UN Group of Friends. I'm curious to know more about what this group does in the space, and also if you could think about, okay, now let's take some learnings for the Asia Pacific region. What can we learn from the work you have been driving with the UN Group of Friends, and also some of the strategies that can also be, adopted in the region in order to better integrate elimination of hepatitis in the broader health system more locally and regionally in Asia Pac?
Sure, absolutely. So the UN Group of Friends to Eliminate Hepatitis is basically a coalition of member states at the UN who are working together to amplify political attention around hepatitis B and C. It was founded by Egypt in 2022, along with 12 other member states, but now it has grown to include more than 55 member states who support the group and raise their voice actively in its favor. And Asia Pacific countries are a large part of it, including Malaysia, who is in the leadership circle of the group. So the Coalition for Global Hepatitis Elimination, we provide the secretariat functions for the group. And at its core, the group is about bridging technical priorities with diplomatic influence. So we have learned that, number one, political visibility is critical. When countries speak at this platform, as they have done through the group meetings, hepatitis gains traction in global political declarations, such as Jessica mentioned, 2025 UN high-level meeting on NCDs, and also the upcoming 2026 high-level meeting on HIV. So this brings me to the second point, that is framing matters through linking hepatitis to liver cancer, UHC, and NCDs broadly, to position it within the broader health agendas and increase the chances of domestic resource allocation. Also, one of the lessons learned was that the regional blocs can be powerful accelerators. While we work very closely with member states at the group, we are also now working closely with the African group, with the G77 and other groups at the UN, and we are working to strengthen these partnerships further. This kind of coordination is something that national and regional strategies can emulate by forming coalitions within their ministries, within their parliamentary groups, or regional health bodies. So we learn as we go along the way about new ways to influence these high-level documents and discussions. It's kind of a delicate strategy to bring the attention of permanent representatives and ambassadors and their mission staff to the importance of hepatitis elimination when they have much larger issues that they are occupied with, for example, world peace, wars, and conflicts. That's where most of the funding stream is directed to these days. But they did understand our technical argument that hepatitis B and C elimination can actually help prevent up to 70% of liver cancer cases. So there is going to be hopefully a paragraph in the draft of political declaration on NCDs that will be released and adopted in September this year at the high-level meeting on NCDs. So understanding that hepatitis B and C are chronic illnesses and that liver cirrhosis and cancer are non-communicable diseases, and preventing both of these is rooted within testing, treatment, and vaccination against hepatitis. So this inclusion of the statement in the NCD declaration is a major milestone in reframing hepatitis not just as an infectious disease, but as a core NCD priority, which demands urgent and integrated action. Yeah.
Yeah, and this is actually a great news and much needed. So how can we follow the work and the progress made in the space? Is there any way our audience can connect? Is there a LinkedIn page or a website they should consult?
Yeah, of course, they can always reach out to us, send us the email at the coalition's email address for more information. And collectively, all the information about the group is available at the coalition's website, and we have a dedicated page for the UN Group of Friends to Eliminate Hepatitis.
So I'll probably compile a list of a few resources and websites that our audience and community can consult moving forward. Thanks a lot for sharing this and for driving this important work, Nida, and the entire team. I want to, so we were talking about the future and with Jessica, what can the community do in the future to continue pushing for better recognition of the importance of funding hepatitis elimination and also a better liver cancer management and control. I now would like to switch to the clinician community, right? In particular, Janos, I asked just a few minutes ago to wear your hat as a project leader for the STITCH project. I would like now to go back to your hat as a clinician, and maybe you can share with us your thoughts on what can the clinician community do more. What's their role in advocating for hepatitis elimination, and what can be done maybe differently, maybe in addition to what is done usually? If you have any perspective and any tips to share to your colleagues, that would be really welcome.
Well, I think Jessica earlier mentioned that we should be all hands on deck. It should be a multi-sectoral effort to, at this time, to solidify our efforts towards hepatitis elimination. And clinicians certainly do bring a lot of things on the table. We're not only on the front lines of patient care, but also of policy translation. And I think we have a responsibility to speak up on behalf of our patients, be another voice for the patients if we see them having problems with the treatment cascade because of the different gaps or the preventable gaps in the treatment cascade. We see them getting lost to follow-up because of inability to access care and treatment. So we can be advocates, not just for individualized treatment, but we also can be strong advocates for a more responsive health system, because if the issues are systemic, and then we need to break that down so the solutions are also systemic. So I think through STITCH, we've been able to show how clinical realities can drive, public health in innovation, especially when clinicians are at the table during the early part of the discussions onwards.
Yeah, totally. And I think, some of the most powerful examples of programs and collaborations that I've seen especially in the Asia Pacific region are the collaborations where the clinicians are really there to be the bridge between the patients and the policymakers, right? So I think in that sense, there is a big role and big space, and more should be done. I know there are people like you and many other colleagues from the region who are really leading in this space, but I think definitely this needs to be also done much more in the future. We spoke about political will, and I think, Nida, you mentioned an important point. Without political will, we can't really implement, right? And make sure the programs are rolled out. So if I link two topics, political will and investment, and I put them in the context of current, budget cuts situation, how do you think, countries should now, look into securing diverse funding streams in order to continue implementing programs that are maybe on the paper, but then fundings are missing, so they can't be rolled out. So can you share more about that?
Yes, absolutely. So we are in the age where we have all the tools. reliable diagnostics, treatment, which is now very affordable, and elimination strategies. But without political will and sustained investment, these tools do not reach the people who need them the most. So securing diverse funding streams, including domestic budgets, social health insurances, innovative financing, and development assistance is especially essentials in today's era when the international funding is declining. But political support is just as critical. When governments make elimination a national priority by integrating it into UHC cancer control plans or primary health care, they unlock the system-wide efficiencies and long-term sustainability. My point is that it's always the domestic investment that can be the most sustainable. So as I mentioned earlier, we tried to gather the support in favor of Pakistan's program by involving the non-traditional donors, but it's still an arena that we should explore because, as Jessica mentioned, hepatitis has historically been underfunded. Now, through the group of friends, we have seen that political advocacy works. Countries are stepping up, and not just with funding, but by pushing for hepatitis to be included into global health declarations and SDG reporting. And we have also seen through the group of friends the examples of health diplomacy and South-South collaboration, which is very important, where countries like Egypt have been sharing resources and capacities with Ghana, Uzbekistan, and Pakistan as well. So the message is very clear that elimination is possible, but only if we treat it as a political and financial priority and not just a technical goal. Yeah.
Thank you, Nida, and I really enjoyed this discussion and hearing from your different perspectives, your different roles and geography scope you are covering. Our time is almost over. I would like to end this conversation with one question, the same to the three of you. What is the one immediate, concrete action you would suggest to stakeholders and decision makers in the hepatitis and liver cancer space to continue ensure that testing, vaccination and treatment reaches everyone who needs them? So maybe we can start with you, Jessica.
Thank you. Great question. From my side, I have to say it's empower and fund peers and people with lived experience. They really are best placed to reach those at risk, especially from underserved communities, and they're uniquely placed to provide trusted information, build relationships that can then provide support for linkage to care and ensuring that testing, vaccination, and treatment are taken up, but also support some of the wider needs that some of people may need, and also deliver really innovative services. And I think I could not agree more with Nida's point. Countries that have prioritized and put the political will behind hepatitis elimination are really much further ahead. And I think the same can be said for those countries that have not only prioritized, but who have empowered and put people with lived experience at the center of their response. And I think as well, peers and people with lived experience can really support healthcare professionals and work with them to fill some of the gaps that Janice mentioned, especially around linkage to care and loss to follow-up, and really make sure that everyone that needs it is accessing services.
Thanks, Jessica. Thank you. Your thoughts, Nida?
Yeah, sure. So I'd say that broaden the horizon and broaden the circle and broaden the community in favor of hepatitis elimination. We need to raise the profile and make this knowledge public that hepatitis B and C is now killing more people than malaria and HIV combined. So this deserves attention. This deserves investment on its own. This deserves a separate voice at the level of UN and a separate high-level meeting at the UN. So this is my message, to keep advocating for it, to keep calling for highest level political commitment, and to keep talking about it. Yeah.
Thank you so much. Thank you, Nida. Janus, your one action you would like to recommend to your colleagues?
There's so many actions, and I think bringing it back just locally to the Philippines, my one immediate practical action would be maybe the government working to fast track a social health insurance package for hepatitis. I think a package of interventions is needed, but having a funding really takes a lot of the impediment or the barrier to accessing care for many of our patients. I'm sure there's stigma, there's other things, but once I think we have funding, I think it's one step ahead already for hepatitis care in this country.
Thank you. Thank you very much. Thank you, Janice. Thank you, Nida. Thank you, Jessica, for being with us today. It was a great discussion. So I hope we can collectively do more. And yeah, I wish you a very good continuation with all the work, the great work you're doing. Thank you again, and yeah, see you at the next event. We are at the end of today's event, and I would like to thank our speakers for joining us today, for sharing their insights, their experience, and their ideas for the future. I would also like to thank all of you for joining this important discussion. Today, we've seen that despite many challenges, and particularly the significant funding cuts since early 2025, we should and we can still hold the line and push forward for eliminating hepatitis and better managing HCC in the Asia Pacific and worldwide. We know that we have the tools, we have the technologies, we have tests, we have vaccines, we have effective treatment. Now what we need is political will and sustained investment. So I would like to end with a call of action for all of you, because every stakeholder in the ecosystem, from ministries of health to policymakers, funders, industry, providers, clinicians, patient advocacy groups, and more, everyone in the ecosystem has something to offer and something to gain. So feel free to use the resources available on the APAC Liver Disease Alliance website, such as the infographics and the HCC roadmap that have been shared today. Feel free to use the World Hepatitis Day toolkit in order to raise your voice, advocate in your community, in your family, in your workplace, because together we can reduce the burden of liver disease in the Asia Pacific and beyond. So thank you all for being with us and for being a part of our journey toward a healthier Asia Pacific. See you at the next event, and have a very good continuation.